Okay, now what we're going to do, we're going to work our way to the vertebral column. And first again, we are back to Netter's Atlas of Anatomy. So I want to kind of give you some good, show you some good well-drawn images of these structures first, and then we'll go to the vertebral column we have here and show you some of the vertebrae. Okay. Now the first two cervical vertebrae are uniquely adapted to create movement and support for the head. Okay. Now the first cervical vertebrae is called Atlas. Okay, if you remember Greek mythology, Atlas was the Titan who is holding the earth up on his shoulders. Okay. Now Atlas has a few different structures on here. Remember the occipital condyles we talked about on the occipital lobe? Okay. These attach right here, okay, to these superior articular faucets. Okay, these faucets are kind of hollowed out, smooth areas, so then these condyles right here can attach to those faucets, and then we can create movement. Okay, and then next you have a little every vertebrae is going to have a transverse process. Okay, because there are muscles that are attaching to all these little processes. Okay, and then there's also going to be an inner open portion called the vertebral foramen. Now remember, foramen is an opening in a bone that nerves pass through. Okay, so right here, this is where the spinal cord is passing right, from the skull down into the spinal cord, or down into the spinal column. Okay, and all these little openings of these transverse processes are what make up the spinal column. Okay, and then we have this kind of rounded off structure right here called the articular faucet for the dens. Okay, now we'll talk about the dens when we talk about the second cervical vertebrae. All right, and the second cervical vertebrae is called axis. Okay, so basically on the axis we create rotation. Okay, this is the central axis where we create rotation for our head, and the structure that protrudes upward, okay, that's called the dens itself. Okay, and then there's this rounded structure, the articular faucet, that hooks right in the atlas. And then what happens, these two bones rub against each other, and then when you want to create the motion, when you're shaking your head no, these two vertebrae allow that to happen. Okay, and then again you have a transverse process. Again, every vertebrae is going to have the superior articular faucet, so the vertebrae that's above it can attach to it, and then an inferior articular faucet, so the third cervical vertebrae and so on can attach below. Okay, so these faucets are here, so the bony structures above and below can smoothly attach and form a joint. Okay, so that's atlas and axis. C1, C2. Okay, now let's look at it. Now let's look at the rest of the cervical vertebrae and talk about what they look like, and then we'll compare and contrast these to the rest of the vertebrae. Okay, now as you can see here, these cervical vertebrae are small. Okay, the cervical vertebrae are much smaller. They don't have to take on a lot of body weight. They really are only holding up the weight of the head and some of the muscles and blood vessels and small organ structures of the neck. So they don't really need to be that thick. Okay, so that's why the bodies of cervical vertebrae are really small. Okay, the lamina is really small, the portion that attaches these faucets to the spinous process. Okay, now the spinous process is a protrusion that sticks out of the posterior or backside of the vertebral column. Okay, and the body of the vertebrae always face the anterior side or the front side of the vertebral column, or the front side of the body. Okay, and now one really unique identifying characteristic about a cervical vertebrae is that the spinous process bifurcates or splits. Okay, so it kind of forms a little fork. And that's one distinct way to tell a cervical vertebrae apart from the others, aside from its small size. Okay, and then as you can see, we have the transverse processes. Okay, and then we have the articular faucets. This is the underside or inferior view. This is the superior view. So the superior faucets are on the body of the vertebrae. The inferior would be on right around the area of the transverse process. Okay. And again, these articular faucets are for the vertebrae above and below to smoothly attach to. All right. So now next, let's work our way to the thoracic vertebrae. Okay, now thoracic vertebrae have some rather unique structures to them as well. Okay, now thoracic vertebrae we have 12 thoracic vertebrae and we have 12 ribs. Okay, so all 12 of our ribs attached to our 12 thoracic vertebrae. Now, as you can see, these vertebrae are structured rather similarly. You see a body, spinous process, transverse process, articular faucets, superior, inferior. Okay, very similar, but in overall basic structures. But how these structures are organized are a little different from area to area of the vertebral column. Okay, now thoracic vertebrae are going to be bigger than cervical vertebrae just because they're withstanding more force and body weight. Okay, and so you can see the spinous process is longer and a little bigger, and the difference between a thoracic vertebrae and a cervical vertebrae is that you just see one bone. It doesn't bifurcate like the cervical vertebrae. Okay, you have a transverse process, and on the very distal end of the transverse process, there's a faucet for the ribs to attach to. Okay, and then there's another faucet on the body of the vertebrae for another section of a rib to attach to. Now, when ribs attach to these faucets, they're secure but not 100%. Okay, so what happens when we breathe in, your ribs actually rotate ever so slightly in these faucets, which is a really good advantage, because if we need to take in a lot of air, we can expand our rib cage even more if we rotate our ribs up and out. Okay, and then you can see the thick body, which is filled with spongy bone and red bone marrow, and then the vertebral foramen. Now you'll notice as the vertebral column or the spinal cord travels further down the vertebral column, it gets smaller and smaller, and you'll see that as the vertebral foramen also gets smaller and smaller. Okay? So these are the thoracic vertebrae. Now let's take a look at the lumbar vertebrae. Okay, now the lumbar vertebrae, these are big, thick vertebrae. Okay, as you can see, the body is very big, it's very thick compared to thoracic and cervical vertebrae. Okay, mainly because there's a lot of compressive force because there's a lot of body weight put on these. So your bones had to remodel or lay down more tissue in this area to try to compensate for that excessive force. Okay, and then you have the transverse processes, you have the spinous processes, and then you have the vertebral foramen. Okay, now the spinal cord itself terminates around the area of your first lumbar vertebrae. Okay, an area and it forms something called the medullary cone, and then the cauda equina from there. Okay, we'll talk more about that when we get to the nervous system, but L1 is about where your spinal cord itself actually ends. All right, and then again you can see these superior articular faucets, and then this is again where the vertebrae from above attach to. Okay. And notice the spinous processes of these areas are also big and thick. Okay, these are by far the biggest and most thick vertebrae of your vertebral column. All right. Now, last but not least, let's talk about the sacrum and the coccyx. Sacrum and the coccyx. Okay. Now, the sacrum, what this is 5 separate vertebrae that are fused together. Okay, during embryonic development, these 5 fuse together, and then on the superior aspect, there's a faucet or a flat surface for your 5th lumbar vertebrae to sit right on top of. Okay, and then on the posterior aspect of the sacrum, there's another flat surface where the spinous process of your lumbar vertebrae can also smoothly fit right into. Okay, and then if you go down just a little bit to the inferior portion, you have the coccyx, or what's often called the tailbone. And there are 4 little bony segments of your tailbone as well. And again, these also fuse together during embryonic development. Okay, and these holes within the sacrum, there are pelvic or sacral foramina. Now these are openings. Again, a foramen is an opening through a bone that nerves travel out of. Okay, so there are nerves that travel from your sacrum that innervate or stimulate cells of the lower portions of your body. Okay. So now let's actually take a look at the vertebral column right here. Okay. First, you see the first two cervical vertebrae are atlas and axis. Okay. You can see the transverse processes. Okay. And then this would be the dens of axis, the second cervical vertebrae. And then, like I said, where axis meets atlas, you can create rotation. Okay, you can create rotation. Now look at the bodies of these cervical vertebrae. They're very small. Okay, they're small. They get bigger as we travel down, just because the more and more body weight that is being put on these, the more force is being put on these, the bigger and more thick they have to be to withstand that weight. Okay, and then if we come to the posterior side, again, notice how these cervical vertebrae bifurcate, or they split, and they form these two little jutting processes. Okay? And then it's pretty easy to spot the first thoracic vertebrae because, this is where this is where ribs 1 through 12 attach. Okay? And like I said, the bodies of the thoracic vertebrae are more thick. The transverse processes have these specialized surfaces, these articular faucets for the ribs to attach to. And then they have longer and thicker spinous processes than the cervical vertebrae. Right? And then we go down to the lumbar vertebrae, and these are big. Okay, you've got big, thick bodies, okay, because there's a lot of body weight and compressive force being put on them. You have fairly small transverse processes, but large spinous processes. Okay, and then as you can see, these would be like the articular faucets right here that you find on the ribs, and then or the vertebrae, and then this is where the vertebrae from above can insert in. Okay. Now, you have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 sacral vertebrae, and 4 costal vertebrae, for a total of 33. Okay, so you should know that there are 33 total vertebrae within your vertebral column. Okay, and now that we're here, then we have this rib cage attached. Let's talk about this for a second. Okay, on the anterior portion of your thoracic cage, you can find your sternum. Okay, your sternum can be broken down into 3 parts: the manubrium, the body, and the xiphoid process. Okay, and then you can see where your ribs come in and attach on the anterior side to your to your sternum itself. Now, what you see here, this is called hyaline cartilage. Hyaline cartilage is rather elastic. Okay, now that's a good unique characteristic to have, because when we want to breathe in, okay, this cartilage can expand and stretch, and it makes it a lot easier for us to expand our thoracic cage and move air into our lungs. Okay, and then as you can see, you have 7 ribs that attach directly to the sternum. So you got 1 rib to 1 attachment point. Those are called your true ribs because they're truly attached to the sternum. Okay, and then ribs 8, 9, and 10. Okay, ribs 8, 9, and 10. These are called false ribs because 8, 9, and 10, what they do is they come in and they attach to the costal cartilage of rib number 7. So they don't directly attach to the sternum itself, but they still we are still able to stretch and expand this cartilage when we breathe in, therefore expand our rib cage and allow us to bring in more air. Now the final 2 ribs are what we call floating ribs. Okay, ribs 11 and 12, as you can see here. Now as you can see, there is no direct attachment to the sternum with these ribs. Okay, so kind of the idea, or the one of the big thoughts behind why we have these 2 ribs is protection, to help protect the spleen, to help protect organs of the abdominal cavity that are kind of tucked up underneath the rib cage. These floating ribs kind of sit around the upper third to 2/3 of your kidneys and help protect them as well. Okay, but these ribs themselves don't play a role in breathing at all. They're there. Okay, they're attached to your T11 and T12, the last 2 thoracic vertebrae, but they're not attached to the sternum. Okay, so that is the vertebral column, the sternum, the ribs. Again, 1 through 7 are true ribs, 8, 9, and 10 are false, and 11 and 12 are floating. Okay.